Hello, welcome to my channel. This is your girl Nurse Ify. Today I am going to be talking about anti-hypertensive medications. This hypertensive medication, like I talked about hypertension or blood pressure in my last video. I talked about how you can teach these patients to be able to check on their blood pressure and the consequences of this. I said something about stroke. I also want to add that it's not only stroke that can occur because of high blood pressure. We can have some kidney failure. We can also have heart failure, because of our blood pressure being higher than normal. Okay, so today I and some other things that can occur too through that blood pressure, but this three is really an emergency situation and that needed to attend to serious consequences of blood pressure. That's why I'm stressing on that. Today I am just going to be talking about the anti-hypertensive medication. These are some of the flashcards that I have here. These medications are the medications that have to do with patients with high blood pressure can take to help lower their medication. These medications, you cannot find it over the counter. These medications are prescribed by the doctor. It's not something that you can get over the counter. So don't just look at it here and think, okay, I can run to the store and ask the pharmacist or get it over the counter. No, it's not. These are prescribed medication, and when patient is taking these medications, we need to monitor their blood pressure. We need to monitor their intake and their output. We also need to monitor their labs like creatinine level, their BUN, their hematocrit, and the hemoglobin. These labs are things, potassium. These are things that we need to monitor in their life. We have to monitor their weight. Like at the beginning of the shift, when I come in on shift, the first thing I do is usually to look at my patient's lab, look at their weight, look at their history, because what this does is that it helps me make a better judgment if I will give this medication, if I will hold it, or if I need to call the doctor for this medication. So this particular one I'm holding up, Mildred, is one of the medications that help to increase blood pressure. So this medication increases blood pressure, while the other ones that I showed decreases blood pressure. This one increases blood pressure. So say if my patient blood pressure is like 110 or 110 over 80 or 120 over 80, I will hold this medication. But if my patient blood pressure is below 100, say 90 over 80, I will give this medication, because what this medication does is that it kind of increases the blood pressure to where we want it to be. So that is just the little video that I want to show today, to just show you some of those drugs that can treat blood pressure. And like I said in my video, any of these drugs that I showed you, if your patient is in it, or if you are watching this video and you're at home and you're taking any of this medication, please make sure that you get up slowly. Make sure that before you take any over-the-counter medication, any food supplement, anything, make sure you talk to your healthcare provider. Make sure that you monitor the input and output. Make sure you eat good diet that is low with sodium, and good exercise. And I'll see you on the next video.